And welcome back to the Morning Blend. Did you know that one woman dies every 7 minutes from breast cancer? October is Breast Cancer Awareness Month, and today a major breakthrough in genetic testing. We're going to talk with Dr. Ora Gordon. She is a nationally recognized expert in hereditary cancer, and she is here to introduce us to the risk score. Good morning to you, doctor.
Good morning.
Some of these statistics are unbelievable, including the fact, too, that this year more than 252,000 new cases of breast cancer are expected to be diagnosed in our country alone.
Right. It is, this test is transformative in terms of being able to identify women who are at increased risk for breast cancer, and therefore being able to tailor that woman's care to prevent breast cancer or detect it at the earliest stages possible.
So let's talk about this risk assessment. Which women are going to be candidates for hereditary cancer risk assessment and the genetic screening for breast cancer?
So the very first step is knowing your family history. But people have a lot of misconceptions. They think you have to have a lot of breast cancer in your family in order to be at risk for a hereditary susceptibility, or that your father's breast cancer family history doesn't impact you as a woman. But neither of those are true. And really, having just one family member, one woman with breast cancer under the age of 50, or a family member with ovarian cancer at any age, is enough to be eligible for hereditary cancer testing. But 90% of women who undergo genetic testing for hereditary susceptibility, we don't find a mutation. That's where the risk score comes in.
Let's talk about the risk score test. What is it exactly?
So the risk score test is a combination of genetic markers with that woman's family history and her personal reproductive risk factors to give her a personalized, individual lifetime risk for breast cancer. If she has an elevated risk for breast cancer, 2 or 3 times the background, we have a treatment plan that will include enhanced surveillance, things like a breast MRI, preventive medications which can reduce the risk for breast cancer by 50%, helping that woman optimize all of her lifestyle factors that can improve breast cancer risk, like reducing alcohol and ideal body weight. And if she's not at high risk, even though she has a family history and her lifetime risk is population, she can be unburdened from that extra surveillance, from that extra worry, and have routine surveillance.
It's wonderful that the results of that test are helping patients as well as helping guide treatment decisions. In terms of options that are available to women who are at high risk, how does it help with that?
So being able to really identify who's at high risk and who is best going to benefit from things like a breast MRI or these preventive medications is essential in being able to get the most benefit and the least likelihood of false negatives or excess testing. So it's really being able to personalize, like we've been talking about for years, in terms of trying to know how should my care be different than somebody else's care.
It seems like there are so many medical advances, and now there's so much more information about genetic testing as it relates to breast cancer. Yet every day we all know somebody who's diagnosed, and it seems like still so many women are dying from breast cancer. Why do you think that is?
Well, in part, it's because we're still detecting breast cancer late for many women. I mean, there have been tremendous advances and really targeting therapy to make the treatment of cancer more individualized as well, which will have a big impact on breast cancer treatment. But this test is really about risk and identifying people before they have breast cancer to say, are you at higher risk, and what can we do to prevent that breast cancer from ever occurring?
Where can people go for more information about all the things you talked about, including the risk score test?
So for more information on the risk score test, I would recommend people go to Myriad.com, to the Myriad website. But know your family history. Talk to your doctor. If you think you might be at risk, take a hereditary cancer quiz at hereditarycancerquiz.com and get all the information you need.
Dr. Gordon, thank you so much for your time this morning. We appreciate it.